I'm Andre Sr. with KTVU in the San Francisco Bay Area, and joining me now is Dr. Allison Jackson to talk a little bit about this issue that we're dealing with. Allison, Dr. Jackson, let's talk a little bit about, first, give me your thoughts on what's going on right now.
Well, I think top of mind for everyone, obviously, is the pandemic with COVID-19 and kind of the implications or the effects that it has on families and children who are, as we all are trying to manage in this, what seems to be new normal climate of isolation, physical isolation, that we all are taking for good reason, for the safety of ourselves and loved ones and our community. But it is certainly having an impact on families and children.
So right now we're hearing about the surge in suspected child abuse cases. What do you think is the dynamic in the homes that are leading to this surge at this particular point?
Well, we know that first we know that child abuse, whether it's physical, sexual, or emotional, and neglect, can occur in any demographic, any socioeconomic level, kind of across cultures. We know that at baseline. But we also know that there are certain circumstances that can increase the risk for children and families. Certainly, a parent or caregiver who has their own history of childhood trauma or mental health diagnoses that may make it more difficult for them to cope with their children or their children's behavior. And then certainly there are the stresses of finance, employment, childcare, all of which are exacerbated right now under the current circumstances. And children are home. Parents traditionally get some sort of break from their children when they go to school. But for those who are not accustomed to having their children at home all of the time, they are having to manage that in addition to the other stressors that are at play at this time. And so it can be rather chaotic for parents to manage.
But what do you think? What leads a parent to look at the child and say, "You are," that is it something that just happens in their mind, that just snaps in their mind that causes them to lash out at the child going through a time like this?
I think when we contemplate child abuse, we have to recognize that parenting is hard. And the temperament of a child, every child is different. And it may not match the same temperament as their child under normal circumstances. Most parents are loving, nurturing parents. However, there are certainly parents who cannot cope with certain situations, or they don't cope well with certain situations. So some acts of abuse may be completely impulsive, and some more egregious, and maybe some of the more troubling scenarios are those where it seems to be in some ways premeditated. I think the circumstances that COVID has created really lend themselves to the more impulsive lashing out of frustration, anger, and even rage that parents may be grappling with over the course of, and I should say not just parents, but those who might be responsible for caring for a child, because some parents are essential workers. And they have to have someone to watch their children. And so whether it's the parent or some other caregiver, the ability to cope with children who may be themselves also, and I shouldn't say maybe, they are stressed. And it may manifest in their behavior and their ability to focus. They may be bouncing off the walls. And that can be very difficult for even the best of parents and those who can cope well. But for those who cannot, for a host of reasons, they may lash out at their children.
You just said something that was interesting to me, and that is that children are stressed as well. And we always think of the stress in times like this as being stressful for the adults, the parents. So, in the situation, in the sphere we're talking about, this type of abuse and children being stressed, how do you identify that a child is stressed at a time like this, and how do you help with that situation in an effort to stave off any potential abuse?
Well, kids need structure, and the biggest structure that we have for them typically is school. So that element of structure right now is not on the table. And even for those who might have online learning made available to them by their schools or school systems, it's still not the same level of structure that it would be ordinarily for a child. And though they may not act like they like the rules, children actually do benefit and prefer to have rules and guidance and structure. And so one thing that parents certainly can do is to try and create a schedule. Maintain some kind of routine. Don't make every day a free-for-all, because that is bound to end up with some level of frustration, some misbehavior, or someone getting into something that they should not have gotten into. And so making sure that there are some boundaries around that. And that means, that should include kind of the downtime, the free time, but having some level of structure, I think, would be helpful for children and parents alike. So, kids can manifest stress in a number of ways. They can have kind of regressive behaviors where, they may, for younger kids, that may be wetting the bed or things of that nature. They may be irritable. They may seem angry. Children are not unlike adults in the sense that the things around them can stress them out. And that is so true for children, even to the extent that children can also pick up on the stress of their parents, even as young as infancy. And so it's important for parents to stay connected to their peers, their loved ones, to allow themselves to have some adult time, even if it's in a closet or a bathroom, depending on the structure of their home, but to allow themselves to create some sort of break, take their own personal time out, so that they can be better equipped to deal with their children. I think it's also important to acknowledge that mental illness is prevalent in our society. And for people who have pre-existing mental health concerns or diagnoses, it's important for them to stay connected with their mental health providers. Many mental health providers are doing telehealth visits. And while it's maybe not the ideal format that many people would prefer, it is available, and it is an opportunity for those who are struggling and who had issues at baseline to still be engaged so that they can get the support that they need to kind of carry on in a healthy and productive way during this time.
Yeah, a lot of doctors are doing telehealth right now because that's the safest way to help people. I was reading a statistic that said girls are more likely to be sexually abused by the time they're 18. Can you talk about the statistics and between girls and boys in abuse?
Sure. So kind of the general statistic is about 1 in 10 children by the age of 18, which factors out to be about 1 in 7 girls and 1 in 25 boys by the age of 18. I look at that with some caution because I do think that females are more likely to disclose about sexual abuse than males. And so we have to at least be cognizant of that dynamic when we look at those kinds of statistics. But it is common.
Sorry about that. I
Bless
had to
you.
sneeze. Um, it is common, um, more common with girls, although you have a little caveat there, because you might think that boys are more apprehensive to say that they were abused.
Correct.
All right. So what else crosses your mind right in the middle of abuse and this COVID-19 pandemic that we're in right now?
Well, I worry as a pediatrician and a child abuse pediatrician about what can be happening in homes right now. We know that the biggest reporter, mandated reporter of child abuse, is the schools, educational professionals. And that reporting block is not there. And if we really reflect on it, it makes sense that in that space where children are apart from their caregivers, that might be the space where they are more apt to share about what's going on at home. They may feel more comfortable doing so in that venue. And so while child abuse or child welfare hotlines may not be receiving the volume of calls because of the closure of schools, it does not mean that it is not happening. And that includes physical abuse, sexual exploitation or trafficking, and emotional abuse as well. Not to exclude child neglect, but certainly I think the abuse categories, if you will, are what we are particularly concerned about in this current crisis. And I would also add to that exposure to domestic violence, because we know that domestic violence is also increased during this time period of seclusion. And there are many children in these homes who may also be experiencing, not only witnessing that, but may also be victims of abuse themselves.
It's funny that it's one thing that you never really thought about at the beginning of all of this, staying at home and thinking about the abuse of other people and children as well. But are you getting a lot of, as a doctor yourself, getting a lot of calls about this right now?
Well, because reports are down, we are
Yeah.
not getting the children who would present to school with injuries or disclose something
And
at
does that
school.
concern you? Yeah, that's the other thing. If you're not
It
getting them, does that
concerns
mean,
me.
yeah,
It absolutely concerns me. And, we are kind of bracing ourselves for the aftermath in hopes that children will, if they are not finding ways to seek help at the present time, that they will be willing to share and ask for help when they feel that it's safe to do so.
wow. What other ways can a child in this particular environment right now, being centered at home but are being abused, in what way can the public, I guess, look out for them?
Um, you know, if you see something or hear something, do something. Call the hotline if you hear or see something that makes you suspect that abuse is happening. Certainly, child welfare agencies are still operating and would respond to those calls. Um, and then on the flip side of that, I think it's also important to be supportive of parents, the parents who might be your neighbors or your loved ones, even though you may not be able to babysit right now or have them come over for a visit. You certainly can reach out to them and offer help, whether it's having a lunch prepared for their kids, giving them some sort of break, listening, allowing them to vent. Every now and then, people just do need to vent about this is hard, and we have to acknowledge and appreciate that this is not easy for anyone.
Um, let's talk about the levels of abuse. Some people might be confused as to what it constitutes abuse. Is it just to smack? Is it just, what you think about when you completely beat a child? What in the definition as a doctor constitute child abuse?
So from a kind of medical diagnosis perspective, physical abuse would be an injury that has occurred to a child as a result of an act, a physical act, an inflicted act. And that could be hitting, punching, kicking, shaking, burning. There are kind of, I can't limit the possibilities of what people are capable of doing to children, and certainly to the extent that my colleagues and I have seen over the course of our careers, certainly anything is possible.
What communities do you consider the more high risk communities for this to happen right at this particular point?
Well, as it relates to physical abuse in particular, I would say the risk is variable. And what I mean by that is the risk for the most severe and morbid outcomes really are parents of young children. So anywhere between 4 to 8 children die each day from child abuse or neglect in the United States. That's at baseline. That's pre-COVID. It's quite possible that that would increase or trend upward as a result of COVID. So certainly parents and caregivers of young children, when there is an unrelated male caregiver in the home, that certainly can increase the risk for children. Domestic violence in the household can increase the risk for children. Anywhere from 30 to 60% of homes where there is domestic violence, there is also child abuse. Certainly parental mental illness, substance abuse, those kinds of elements can increase the risk for families. We know that there has been a trend where economic difficulties increase the risk as well. We've seen that for abusive head trauma in particular. But we also have to acknowledge that families of more affluent demographics tend not to be reported as often. And so we have to be mindful that in those statistics, maybe children may not include children who are not getting reported because of their status.
What are you and your other medical professionals in your area of expertise doing at this particular point? Are you, when you're meeting with patients over virtual video conference like this, are you looking out for signs, things like that?
Well, I am not a primary care pediatrician any longer. So I don't have those kind of opportunities to see children for kind of routine pediatric care. But I certainly hope that my colleagues who are primary care docs seeing children for routine visits or sick visits are astute to some of the findings or symptoms that might be suggestive of child abuse. And, that's a tricky situation to navigate as a primary care provider, certainly virtually, even more tricky to navigate that. And, as healthcare professionals and physicians, we seek to do no harm. And so we want to engage with a child in a way that does not put them at risk for any increased harm in these circumstances. And so that's a delicate balance, but certainly eyes and ears on are critical for any healthcare provider.
Anything that I haven't asked you about yet that you want to make sure that we get across to folks who are watching this?
I think, this is an opportunity to really recognize that how difficult parenting is under normal circumstances, and to really make sure that our communities are ones that support safe, stable, and nurturing families, communities. We have a society that has typically celebrated violence, sexuality, and what I mean by that, I don't mean sexuality of an individual, I mean sex. And it has manifested and permeated in the direction of children. And so as we take advantage of things like this, being able to do things by way of Zoom and all the other platforms and social media platforms, we have to also recognize that we have to adapt our prevention efforts on the part of parents and caregivers and professionals to adapt to the changing technology and be aware of what kids can be exposed to on these various platforms. There's good with it, but there can also be risks with it. And so I think this is an opportunity to kind of raise the awareness. This April is Child Abuse Prevention and Awareness Month. And so maybe it is in some ways not by accident that we are kind of elevating the issue out of necessity, unfortunately, but child abuse pediatricians everywhere would say that the necessity has been here all along.
Well, Dr. Allison Jackson, thank you for sharing your insight into this very important topic, especially at a time that we're going through such an unprecedented situation. And thank you for sharing your thoughts. And hopefully what you talked about today will help folks that are watching this. Appreciate it.
Thank you so much. I appreciate it as well.
Okay.